Dr. Jay Calvert here. Got a little update on, I guess we're into sort of the end of the second week of this coronavirus pandemic, national social distancing, lockdown, whatever you want to call it. I think overall, I am very impressed with the way that our nation has responded. I'm impressed with the people's willingness to close their businesses, do social distancing, really sanitize everything possible. And I gotta say, in my estimation, it's totally working. I expected Los Angeles to be totally overwhelmed with cases at this point. And there are a lot, by the way. Los Angeles has a lot of people coming in requiring ventilators, and this is the big deal. So what I want to talk about today is the pathophysiology, the mechanism by which coronavirus causes people to not be able to breathe for themselves, that they need to be on a ventilator. And the way that this virus is working is, it's interesting. What it does, it gets into the cells and it lives in the respiratory tract and in the lungs, as we've talked about. So once it gets into the lungs, that's when you start to get that fever at 5 days. You know, again, most people who get this virus aren't even gonna, they might get light symptoms, they're not gonna get very sick, it's gonna come and go, that's it. A lot of people aren't even gonna know they have it. For the people that do get sick, 5 days there's a fever, 5-6 days after infection. So that's when I think you gotta start treating. Because if you stay in that I'm sick zone for too long, that's when the respiratory component can go to a life-threatening situation. And again, it's not many people. The death rate of this virus, when all is said and done, and we actually put the number of people next to the number of people that died from it, I think you're going to see it's a very low mortality. But for those that do get to that point, it's fast. So the way that I'm understanding this, because I am not in the emergency room, not in the ICU, but my understanding is that on that 10th or 11th day, that's when you start to develop this pneumonia that ultimately leads to ARDS, which is Adult Respiratory Distress Syndrome. And once you've gotten there, you're like, that's terrible. So they are being very aggressive about intubating patients, getting them on the ventilator, and then treating them. And coupled with that pneumonia is when there's a cytokine storm, this inflammatory response that the virus elicits that really, causes the lungs to just crap out. And this is where the getting rid of the virus piece is really important. Because again, in the French studies, and now there's a larger study out of France that's been published that shows, and it's with 80 patients, and it shows that again, with the Plaquenil, the hydroxychloroquine, the viral load decreases to nothing detectable on PCR at the 5th day. So that's a big deal, because if you just treat with antibiotics, you still have the virus there. So if you're treating the infection, that super infection, because again, there's no way to destroy the virus except, we believe, this Plaquenil, and then there's also some other antiviral drugs that are being tested, but I don't have data on those yet. So I've already gotten kind of, don't mention anything until you have data. So now I've got the data from France with 80 patients. So that's the thing, is that you want to reduce the viral load. Again, it does appear to be dose dependent, which is why the healthcare workers are getting so much of this. And then you want to get the inflammatory response under control. Interestingly, out of Massachusetts General Hospital came a report that all the patients that this one guy was taking care of, he's an ICU doc, he put out a communication that they had all taken Advil and gotten worse. And something about the Advil makes, and there was a scientific letter also about this that said that the Advil makes the virus kind of more comfortable in the cell and can do its work. Tylenol will do fever reduction if you get this. And the other thing I think is you got to be in touch with the doctor. You got to get treatment. So the things that I think that are going to make this better faster is more testing and more treatment and faster treatment. Doing it in the outpatient setting before you're walking into a hospital to get a ventilator. Again, information is the key. I'm not an infectious disease expert. I keep doing these videos so that people will know what's going on. They can look for themselves. I am incidentally sitting by one of my paintings that I did a long time ago that is very relevant for right now. So I think everybody just keep doing what you're doing, work hard, take care of each other. Thank the doctors, the nurses, the allied health professionals, the nurse practitioners, the PAs, the x-ray techs, all the administrative people that are working in the hospitals right now to really get us through this pandemic. The first responders, firemen, police, they're making us safe. The grocery store workers, the cashiers, really, time to be grateful. And that's the hard part for everyone, is that we all have to do this, but it's really so that the pandemic cannot create the long-term havoc and problems for us that it would if we went unchecked. So I hope this is helpful. Send me your comments or questions, and I will see you again very soon.